multi-tiered systems of support is, as defined, is a concept identified in the School of Health article, which is described as or defined as an integrative framework for organizing school-based approaches to preventing and addressing emotional, behavioral, and academic problems for all youth in a building or a district. And the other thing with district-based providers is you can potentially have a centralized pool of specialty providers, not just behavioral health, but audio and visual specialist, psychological testing specialist, behavioral health specialty prescribers, physical therapists, occupational therapists. These are and special education specialists of various subspecialties, and they can be kind of deployed as needed across a network of district schools within a single district, which is not something that could easily happen in a outside of in a kind of a general civilian community. So the tiers in the multi-tiered system of support model represent the level of need for each student. So the multi-tiered systems refers to levels of need for each student. And of course, with all students receiving at least one tier of support, as well as the inclusion to, in terms of utilizing this model, that would require universal screening of all students to identify those at risk. Okay, so they're going to go. So a big chunk of this article is the author's description of this proposed multi-tiered systems of support model to improve the provision of behavioral health services within schools and take advantage of the somewhat existing kind of closed network of or shared network of services that already exist within most district-based models, school models. Okay, so however, research indicates that in reality, despite the efficacy of this multi-tiered system of support, screening for mental health problems occurs rarely, and relatively few school-based providers routinely track behavioral health outcomes. So, and, I can definitely say that was consistent with my experience too. One of the things that I recall from the last time I did school social work was that working under a contract, I was, my role was supposed to be in my, my lane, as it were, supposed to be provide, services to students identified through existing IEPs, and not only was I really not, supported by the contract to kind of provide, additional screening and some kind of as needed behavioral health intervention, although I did a good bit. But there was also, there was a Pride social worker for the Pride program, if you're, which is kind of somewhat of a special ed program, including specifically for children with behavioral health needs, as well as academic and educational needs. At least that was my understanding of the Pride program. But there was no dedicated social worker to this particular school that I was at. So whatever social work services they got and whatever behavioral health services they got were whatever I was able to provide, kind of in addition to my assignments with the, within the within the existing students identified through IEP. So the cloud. So anyway, so there are there's certainly nothing even close to screening for mental health or behavioral health problems outside of a concerning behavior from a student, and then being asked to try to intervene, at least in somewhat of an ad hoc kind of way, but certainly no routine screening. So the only tracking, and so behavioral health outcomes may be tracked within the context of an IEP or a 504 plan, but not outside of that. And again, just that piece of it is not from the article, just from my own, somewhat limited experience as a school social worker. The collaborative care model may create an opportunity to implement and screen more acceptable and feasible to school. That's kind of awkwardly written, but the collaborative care model, so what they say that they can do is do more screening if they have more coordination and collaboration among behavioral health staff, and that can include not just behavioral health specialist staff, but other school-based, kind of cross-section of school-based staff, school guidance counselors, occupational therapists, speech therapists, special ed, these different kind of specialties that are, that are, at least available somewhere within the school system, or they're available, from the centralized part to be deployed as needed. School support teams that are built upon a collaborative care model already are usually consist of school employed professionals spanning school leadership, academic counseling, and behavioral health counseling. So, so the collaboration model is where it does exist usually represents a collaboration primarily among school leadership, principal, assistant principal, and other administrative leaders, the guidance counselors, and available behavioral health counselors. Through these type of support programs, though these support programs are often challenged by insufficient structure and rarely incorporate health providers outside the school system. So in other words, there's not enough human and non-human infrastructure, as well as really very little, as I was telling you, that what the authors state here is my experience too, really very little collaboration between school services and community health services, including primary health services, let alone behavioral health services.